Welcome to the comprehensive overview of client management on BirthSync. We are going to go through the client directory and the client card documentation system. We've already covered overview in another video, and this one is for clients. So this side menu is going to be visible on every page in the platform. So is the top menu that lists your agency name, search box, your ticket reporting, the change log for BirthSync, and then your in-app agency notifications. Starting at the top, we have view all assignments, and what you can do here is click it and see who's assigned to who over the course of the agency on the date of generation. So it's going to give you the client name, the service type, the status of the provider, and then if they're pregnant, a due date. You can also download that report. You're also going to be able to manage archived clients. So an archived client is one that you do not want to hard delete or completely get rid of. You may want to complete the work that you've done on them and then just leave the chart as it stands for later use. If you have clients here that are archived, we have a test client, you can manage them, unarchive them, or delete them permanently by clicking on an archive chart. You will see it is in read-only status, and it's going to give you a little tag that says that it's read-only. So everything that's been done outside of the client goals and education section, but everything else that was charted on this client is going to be read-only. You can't enter any information in. That is substantial, so no more visit notes or anything like that. The care forms will remain, and then the portal activity, of course, will be unable to load because the client is archived. You will be able to export and you will be able to unarchive from this screen as well. So that is a managing the archive section. Adding clients, you choose the primary service that you'll be providing for your client. And once you choose it, you're going to have a intake form that is specific to that client type. So this is just a quick rundown. You can see all of the fields. Obviously, for pregnancy and birth support, you're going to have a pregnancy information box. All forms have medical and health information that you can chart if you know it. Very few of these fields are mandatory for that reason because the information changes. Cultural and personal considerations are going to be there as well. And then just some other important information that may be useful to you and your business, like how the pregnancy was, the method of pregnancy, whether it be in virtual, whether it be surrogacy, etc. It's here, pregnancy method. So you can, and then of course, this is a trial of labor after cesarean. That's also something that organizations and agencies like to track. You're going to do that for each type. So each type of form will have a few shared boxes, but will also be individualized based on the client type that you have here. Newborn care, same here, more baby information, number of babies all the way up to 6, depending on like who you're caring for. Even if you have twins and you're only taking care of one of the twins, you want to just put them there, at least document that they're a double or a triple. And then some of the pregnancy history information, recent meaning this pregnancy for the children that you're charting on or creating a record for. So those are all of the client types. And then lactation is going to be as well, more focused on just baby, mom and baby. Same thing for the baby information. You'll be able to chart up to 5 here, and then the information of the baby that you're helping mom with, and some other shared fields, lactation history, etc. So those are your 4 client types. You're also able to import clients by filling out this sample CSV. It's going to basically tell you exactly what you need to put in, how you need to put it in if you want to bring over clients and upload them from another platform. Moving on to our search, you're going to use the search by client names, client status here, active, birth support, postpartum, lactation. So you can go by service type. You can go by whether their active service is completed or delivered. If you have a birth support client that have a delivered tag, this one is delivered. So it shows up here. And then you have provider search. Moving on to the actual client cart system. One more thing that I want to review with you is tagging. So you can add tags on this page. These tags do not flow into this area here. They're really just for overview, and you can search by tag. So I'm going to select tag, choose a tag. There's only one. Create a new tag, and we'll just say nice. Update the tag, and now we have a new tag, nice, along with our yo. So that is how you add tags, and you delete tags in the same fashion. Selecting, delete, available tags, yo. It confirms the deletion and delete it. Another way that you can delete it is just by clicking that X. Once you delete a tag that doesn't have any other tagging clients, it's going to remove itself from this tagging search section. And let's see here. I want to make sure if you click the tag, that is how you search it. So we will clear that search. Tag is still there. Now we're going to move into our client directory. So we've clicked on a client in our test account, and we're going to walk through each one of the sub tags to see what you are actually going to be viewing and dealing with inside of your chart. So providers who are not agency owners will not have certain views. Your providers are going to have special views. A lot of these menu items will not be visible. It's really going to be down to just what they are going to be dealing with directly, whether that be the clients, the calendar messages, and then if you have a client resources for them to share, and if you have provider resources as an agency that you want them to access, those things are menus probably 30% of what an agency admin is going to view. They will also be able to submit tickets, and they'll also be able to have a simple settings page. So that's just a little bit so that you understand it does depend on the level. The services and products do not typically show, and they won't show for providers at the provider level. Agency staff members and agency admins and owners will see this bottom box for services and products. So we're going to go through the overview. Contact information is pulling from your intake form. You can change your payment method at any time by clicking any of these in this more than one. If you have more than one, it saves the changes. Just keeps that up to date as an informational piece. You have your provider information. So if you've assigned on the main screen and you have backup providers here, everything will show here. And then the service type as well will show. If you have an emergency contact entered in your intake form, that will also pull to this place. If not, it's just going to be blank. Your appointments are going to show here. So any visits that you've documented, even if they're not scheduled visits through the calendar, if you conducted a visit of any type, you charted it in a visit as a visit note, it's going to show here. And so will upcoming appointments. If they are scheduled, they will show. All providers who are assigned to clients will see all of this information minus the services and products. Moving on to the next row, client care snapshot pulls information through based on the service type. So we've got our baby birth info. We have household members. You can add a household member here just by following the prompts. You can also add pets. And then your support system, those questions were asked in the intake form, and it's going to pull through from here. If you need to change how support system is, you'll just have to open up your form, find it here, and change it or update it. All right. Client goals and education. So the preferences are going to be pre-selected based on the service type. Postpartum is pre-selected. If there was birth support, then birth support would be pre-selected. If it was lactation, and so forth. You can chart and record goals and education for any of these preferences, but just know that your service type is the default, and you can switch at any time. So when you click for postpartum, you're going to want to um, look at the support preferences, click what you need to. Any additional goals or needs, you can add them. And then we have a save preferences and a save and sync preference option. So saving the preference basically just puts it on the screen for you to see and for any other providers to see. However, if you sync, it creates a downloadable PDF, and it records this almost like snapshot of what the needs are or the preferences are for the client for you to review later. So saving the preferences short term sits on the front. Saving and syncing creates an actual snapshot that you can view on the records page. We'll get there. Referrals, you can add referrals for clients. This is not a referral for your business. This is a referral for the client. You can add it here. You can plan and then track your status. So if you know that you're going to be referring or you need to refer, you can plan that so that you don't forget about it. You can then, once you do it or send it or whatever it is you need to do, you'll switch your status up and you can complete it, and you cannot complete it. And it'll track that as well, and it'll give it a reason, and it's going to update that referral. For services and products, and this is just an overview, I'm not going to get into too much detail, but when you set up your BirthSync account, you're able to create services with prices. And to be able to track, for those of you who offer other things or have a client buy something else after they worked with you and you want to track exactly what they're getting from you, you can select your service type. So, like the closest thing that you, the closest category that you can have, postpartum support, and then whatever that status is. If it's in progress already, if it's already delivered, you can change your status and just track from here. And then we have postpartum hours. So we're going to say that she bought 10 hours and the purchase date was the first. And if you have any notes, you can put them here. If not, you don't have to put anything there. If you want to add this as a revenue entry for your business, so say this was a gift and you wanted to track that you gifted these hours, but you did not want to add them as revenue, then you would leave this alone and not add. But if you want these hours and this price to record for your business operations, then you're going to click add as revenue, select the payment type that's closest to what you received, and then pick a category. So in this case, it's services and packages, and then you add it. It's going to show at the bottom. And if you click operations, it's also going to show in your revenue tracking postpartum support per hour and our purchase date. And if you click by client, you are also going to see the purchase. So back to our client's card. Screenings. As an agency, you're going to have access to the current screenings that we have available to our users, which is a nutrition assessment, self-care assessment, PASS, and EPDS, which deal with maternal depression and anxiety, and then a latch assessment. If you have a lactation consultant that you work with that is capable of doing a latch assessment, then this is for them. We do not recommend latch assessments being just done and recorded for professionals who are not capable of doing them, and we have put this in writing. So you want to make sure that the person that's recording this for your client, even in a non-clinical setting, is qualified. So that is our screenings. And we have a separate video that goes into the screenings individually, but I just want you to see this is where they live. If you have a solo account, you're going to have access to a nutrition assessment and the EPDS assessment. Send screening links. If you would like the client to fill this out on their own and you're not going to be present to record the answers, you can actually select client, select the screening, and it'll send a link to them to complete it. And once they complete that screening, it's going to auto populate and it's going to have a score or have whatever comments that they have here, and you'll be able to review it. Educational resources. This is great for training facilities, organizations, or agencies that track and report exactly how many hours they're spending or how many topics they're educating on. And we wanted to make sure this was separated so that you could actually go back and report on or update your clients or update your shareholders or whatever on this feature. So you can add education, and you can add education based on the goals. So you have the goals that are still tied to client types, but if you choose a different goal, when you add the education, it's also going to change. So birth and support has a pretty extensive list here that you can choose from, and then you just give a topic and you just note what you talked about, they completed, and who, what provider completed the training. um, when you go to newborn care, you add education, your category will change, and so on and so forth. So um, when you get to lactation and you add education for lactation, the categories are going to be more geared to that. So that's a great way for you not to be able to document your education, but not specifically all tied to postpartum, because we all know that we do teach on different subjects. On to visit notes. This is an extensive, and it also changes depending on the client type, but postpartum, lactation, and newborn care is pretty much going to have this setup. You'll have your visit notes where you can add a note. We've added 2 notes here. It basically gives you, you can click on this and it's going to open up the visit for you. You can click your format if it's not filled in. Um, and it's going to calculate the duration, what you talked about, the client assessment mood, give you your summary, and then you can fill in whatever fields are pertinent to you. And then there's a visit status. So if you are a non-solopreneur or you have many people kind of working for you, and for one reason or another, uh, this status is needing follow-up by an administrative person or agency, owner, somebody that's not the provider, then they can actually tag the visit in that way that will notify you, and it's going to show on your dashboard that you have a follow-up visit or something that needs to be um, followed up with. And once you click follow-up needed, it's going to give you the comment section and who to notify um, once you update the visit note. So we have completed successfully here, so we're not going to update that. But that is a feature that has proven to be very helpful for training facilities, for agencies that things like this may fall through the cracks and lose them business because they were not notified about follow up. We have referral tracking. This is where you add referrals, all the details. You can do this from the first tab, but you can also do it from here. And this is where you actually interact with your referral as far as changing the status and adding different notes. Your client log. So postpartum newborn care and our lactation, you can add logs. All of the client types can add logs, but client logs are going to be mostly helpful if you've already delivered. So we've added one here for our postpartum mom. It's a sleep log, and it basically tells you very briefly the start time and end time of the sleep, where they slept, and then if there's any notes and the date. It's updatable, so you can click in here and update if you need to. And this actually will sync to the client portal, which will be another video. So we'll have that's everything that you have as a non-pregnant client in the visit notes section. Now, records, we have 3 subtabs. We have a documents section where you can request documents and upload them separately. You can also see whatever you sent them to be signed. We'll show here. If you don't use our internal signing system, you can always upload the document here if it's signed, and it will still allow you to see and to track. We have a form section, which is care forms. This obviously will continue to be built out as BirthSync grows, but we started with our pregnancy and obstetrical history, where you can add pregnancy history separately, so that for those who are, multiple babies or pregnancies, or just information that you want to capture, but you don't want to overwhelm them on the intake, you can fill this out separately. And then the immediate postpartum record is mostly for our birth support clients or postpartum doulas that maybe are seeing mom at birth or right after birth. They may also be working with a birth doula that has BirthSync, and they'll be able to view this immediate postpartum record once it's filled out. Goals and preferences. When you had our goals and preferences here, we'll just select some things and you hit save and sync. When you go to the record section, our goals and preferences syncs here. So we just filled it out briefly. We can now download and use this as we see fit. We can review it in paper form with the client. We can also generate a link that allows the client to fill this out for themselves, as well. Portal activity is going to be primarily in another video, but this is where you track. This is basically a tracking system. It's a on demand, always working a way to track what is happening with your client. So if you want them to have a portal, you would send a portal invite. They would set up their account. Even if they don't have a portal or they didn't set it up, all of the information that would sync to their portal is still going to sync. So right here, we have an appointment confirmation that was sent to email, and it's going to sync here. It keeps the total activities. You can send messages to your client through their portal. And you can also send them a separate welcome email if you have more information for them after they accept and set their portal up. So that is just a little bit into what the client portal looks like and what it does. I'm going to just briefly go over a birth support patient or client and the differences. Um, as you can see here, as an admin, you're going to see all the boxes. This particular test client has a referral that's in progress. You can't edit here. You'll edit under visit notes, but you'll see the due date. You see the current gestation, where they plan to deliver. If they have household members, their support system is here. And then they're also their preferences. They may have postpartum, like they may have preferences already that are just need to be recorded. So far, this one is only birth support. And then you also see the current and backup providers, their emergency contact. What changes here for birth support is going to be a labor snapshot. So there's a labor snapshot feature that is unique to BirthSync, and it allows you to track your labor as it happens. So you open up your labor snapshot, it's going to give you a timeline of events. And anyone that's assigned to this client and has access to BirthSync can log in, create a timeline entry, and whichever doula is actually present for delivery would then deliver add the delivery information, or the admin or whomever. So it allows you to actually see the timeline of support. And when you're done, it'll document how long and how many people were supporting this mom through birth. So that is only going to be visible on our birth support clients. Everything else is the same. As you can see, we have a birth support sync that's here. You can compare preferences. You can review changes in preference. Portal activity just gives you an idea, as I said, whether or not they have activated their account. We're still going to capture all of the activity so that you can see and talk to your client about what they should be able to see, and what they should be able to do in their portal. So that is, and you can see the total activity count here. That is essentially an overview of the client management system in BirthSync. And we'll get into a little bit more of the forms and things in other smaller videos, but this is a largely an overview of how to manage your clients in the system, how to view the assignments for them, how to change assignments for them. You can toggle this off. And once you toggle that off, you're assigning a secondary. You toggle it on, you're assigning a primary. You can also clear your assignments from this box. And that is client management.